And today we have from Harvard Eye Associates, if I can pronounce that, Dr. Karen Skarna. And we are talking about a condition I have not heard of before called blepharitis?
Blepharitis, yes, that's right.
All right.
So what blepharitis is it's an eyelid condition that is due to inflammation and sometimes infection. It's divided into two different parts. There's the anterior, the front part of the eye, and then the posterior part of the eye. The anterior part, there's three different kinds. There's staph blepharitis, there's seborrheic blepharitis, and something called Demodex. With the staph, it's due to bacteria that lives in our skin.
Okay.
And that's where you get the styes or the pink eye. So that's what causes those things. Seborrheic is where you get the sebum-rich areas of the eye. And then Demodex is these little tiny mites that live in the eyelash follicles, and they cause the eyes to itch. The eye, if you see anybody who has red eyelid margins, that's what that's from.
Now, those mites, are they always present?
Well, unless you eradicate them, unless you get rid of them, they are present. So I think I have a picture here that will show you that, first of all, the anterior. So this is the eyelash region, and then these are the meibomian glands back here, which is where the posterior blepharitis is. But then there's also, I think, a picture of the anterior blepharitis. I'm not sure if you have it here in the sample.
Let's see.
Oh, here we go.
Okay, there we are.
So if you see these little scales all along the eyelid margin, that's what the blepharitis is, and that needs to be removed because that's all toxic material, and it causes a lot of infections.
Within your eye?
Within your eye, yeah.
Now, as far as removing that, is it just simply washing?
Well, you can do that. Sometimes just plain warm compresses and lid scrubs will take care of that. That's really the most important part of the therapy, is doing warm compresses about 5 minutes at a time, twice a day. But sometimes we need to use topical and oral antibiotics for that. There's also with the Demodex, because they're pretty resistant to the bacterial treatment, we have to use something called Claridex, which is a tea tree base that helps remove the Demodex, the little mites. And then there's also there's a new treatment called Blefex, and Blefex is actually like a in-depth deep cleaner for the eyelid margin, so we can get rid of the material, and then people can manage that better on their own.
Let's talk about how somebody gets this. Is it they're not washing their face? Is it like we all do, we rub our eyes and something's on our hands, or something that's in the air?
Well, you know, the most common type of blepharitis, staph blepharitis, is really due to bacteria that we have that lives in our skin. And it's not something where you're not cleaning yourself. Oftentimes what happens is, like the bacteria in your mouth, it overgrows. So you have to just keep that bacteria under control. Some people manage it well with just normally, and some people have to do scrubs and clean that. Yeah.
All right. Here's some treatments that you were talking about.
Yeah. So warm compresses, like I said, is probably the most important treatment. You want to do that twice a day for about 5 minutes. The lid scrubs are really important to remove the material that accumulates on the eyelash margin. Again, topical antibiotics, they need to be prescribed. And this Blefex, which is a really new treatment, it allows us to clean those eyelashes very well. We can remove that bacteria, we can remove the debris, and then it's easier for people to maintain once they've had that done. Yeah.
And as far as, we're going to look at, we have one more picture, but first, posterior blepharitis.
No, with posterior blepharitis, there's something called meibomian gland dysfunction. It's kind of the new buzzword, MGD. What happens is that the oil glands, they get plugged up, and you need to have the oil on your tear films to just to decrease the evaporation of the tears. So if you see these right here, these are little plugs, and what happens is the oil should look like olive oil when we push on those glands. And when you start to develop meibomian gland dysfunction, the oil secretions get cloudier and cloudier, and pretty soon they look almost like toothpaste. They get stuck, the secretions get stuck in there, and you don't end up having any oil coming onto the eye. Sometimes if they stay plugged up for so long, they end up we lose those glands. And then people have severe dry eye after that.
Okay.
Yeah, so.
So the treatment for this is similar.
Yeah, warm compresses and lid scrubs. Often we have to go to oral antibiotics when it comes to meibomian gland dysfunction to take care of the bacteria that blocks up or clogs those glands. We do manual expression where we go in and we really push on the glands and open them up. Sometimes we have to use the Blepharitis also. And then there's a new treatment out called LipiFlow, and that LipiFlow is a device where you actually put your eyelid into the device and it heats up the gland or the lid. Yeah, from inside and out, and then it massages it and it opens up. Yeah, so, and then this is an area here. It's not punctal probing, it's meibomian gland probing. So if we can't open up those glands with any of these other treatments, what we do is we go ahead and we can surgically open those glands. So that's something you would have to see a doctor to see if that would be what you needed.
Now, as far as getting help for this, how normal eye exam is going to show this? Are people going to start noticing itching in the eyes? I think the scales you would definitely see.
Scales, you know, it's surprising. We have people who have a lot of scales and I don't think they really realize that they do, or maybe they've had them for so long they just aren't aware of it. But oftentimes people come in with itching, burning, red eyes. They'll say their eyelids are always red and itchy. So that's how we really pick it up. You really need to have an accurate diagnosis, because if you don't have an accurate diagnosis, we don't know exactly what we're treating. So, and oftentimes people have seen doctors and they, you know, they're told to do something and they'll do it for a few months and they get better and then they kind of forget and then they stop. And so usually if you've gone in to see a doctor before, it's nice to know what you've had, you know, what you've had prescribed before, to let us know if it worked or if it doesn't work, and that way we can move forward with a treatment that's effective. But I think the most important thing is that blepharitis is a chronic condition. It needs ongoing management, or
you're not going to get rid of it then, totally.
No, you just manage it.
Okay.
Yeah.
Is it something that it's just the same way other people might get psoriasis or something like that, in that you don't really catch it for anyone? It's just
absolutely
something that happens.
Just something that happens, and
All right, very good.
Yeah, thank you.
And I appreciate the information. Great slides. And again, you know, get your eyes examined, and because not just for your sight, but for all these other things as well.
Exactly.
Very good.
Yeah.
Doctor, nice to see you again.
Yeah, thank you. It's nice to be here, and thank you for asking me.
All right, we will see you again, I'm sure.
Okay. All right.
And we'll be right back. Yeah, it's interesting.